Hello, this is my presentation on family systems theory. My name is Travis Boss. I worked with Elizabeth Granda on this for Counseling 5320. So the techniques that were implemented in our mock counseling session were genograms, the miracle question. We focused on those two and then briefly mentioned reframing and boundary setting later in the session. This is a link to the whole counseling session if you would like to watch our progress through these 4 techniques. So family systems theory is a form of psychotherapy that helps individuals resolve their problems in the context of their family units and connections, where many are likely to begin. There are different approaches and techniques based on this theory, but I've chose to focus mainly on those promoted by Murray Bowen, Bowenian family therapy. So at 3 minutes and 28 seconds, we discussed genograms. A genogram is a visual representation of the family tree with symbols and annotations to indicate the relationships, patterns, and issues among the family members. Genograms can help therapists and clients identify the sources of problems, the roles of each member, and the intergenerational influences on the family system. At 10 minutes and 45 seconds in, we discussed the miracle question. So the miracle question is a technique used in solution-focused therapy, often brief therapy, a form of psychotherapy that focuses on the client's goals and strengths rather than the problems and weaknesses. The miracle question asks the client to imagine a scenario where their problem is miraculously solved overnight and to describe how their life would be different as a result. The reframing is another technique in systems theory that we discussed briefly. This technique involves changing the perspective and meaning of a problem or situation in order to create a more positive or constructive outlook. Reframing can help therapists and clients challenge negative or distorted beliefs, reduce blame and guilt, and increase hope and motivation. The final one we discussed was boundary setting. This technique involves clarifying and modifying the boundaries between family members in order to create a balance between closeness and autonomy. Boundary making can help therapists and clients address issues such as enmeshment, detachment, triangulation, and coalitions and promote healthier and more functional relationships. So knowledge of many different kinds of theories really will help find us do a better job of finding the right approach to face many problems that can be unique in the many different people that we'll see as future counselors. So in conclusion, how we connect with others greatly affects our well-being, and family systems theory considers those connections and puts them into context when assessing presenting problems. Additionally, there's many great interventions which can be used in conjunction with family systems theory techniques. It was a great exercise to be both the counselor and the client for this practice assignment. It caused a little bit of anxiety and we had some technical difficulties, but Elizabeth and I were able to power through, and it was fun to be on both sides of this practice experience. I look forward to doing more in the future. All right, thank you very much for listening.